Hi, hello. This video is all about OET exam preparation tips. Now, despite the countless materials that you would have practiced, the sleepless nights, the confidence with which you have booked the exam day, it's altogether a different experience. It can actually bring in cold shivers. So how can you tackle this? In this video, I would be sharing some tips which would come in handy on the day of the exam. So let's start. Now, first of all, what you need to understand is knowing the format of the 4 different modules is of utmost importance. You might be knowing how to approach each module, but exactly knowing the format of all the modules, what are the do's and don'ts in each of the modules is equally important. So let's start with the listening module. Now, in listening, the format is that there are 3 parts, part A, part B and part C. In part A of OET listening, what you get to hear is healthcare consultation. That is, a healthcare professional would be interacting with a patient. So you will have 2 such consultation extracts and each extending for approximately 5 minutes. So in part A, you will get to hear 2 healthcare consultation extracts with each extending for about 5 minutes. Then in part B, what you get to hear is 6 workplace extracts. That is, you will be hearing 6 short audios extending for about 1 minute, wherein you will hear healthcare professionals interacting with one another. Then moving on to part C, what you get to hear in part C, either it will be a presentation or an interview, and each of which will be extending for about 5 minutes. So this is the format of OET listening. I hope that is clear. Now, regarding the question type and how to answer each question type, when it comes to part A, the question type there is completion type of question, wherein you will have gaps or blanks in between the questions in the question booklet, and you have to fill in those gaps as you listen to the audio. For example, here you can see a sample. Here you can see a blank space and you have to write the answer exactly on this blank space, which means that you should not be placing your answer here or here. Exactly, you have to fit in your answer into this blank space. That is how the questions will be in part A of listening. Now moving on to part B and part C, both will have multiple choice questions, and the questions in both part B and C will have 3 options. So what you have to do is, as you listen to the audio, you have to decide on the most appropriate option. Once you have understood a specific option as the right option, how you should be marking it as the answer is by darkening the bubble. And as you darken the bubble, you should be careful to darken it properly. Make sure that you darken the bubble appropriately. That is, it covers the entire bubble. It should not be over bubbled like darkened. It should not go outside the bubble, or it should not be partially darkened also. In such situations, it will be considered as an invalid answer. And also, if you darken 2 bubbles, even then it is considered as invalid. So these are certain minute or minor aspects which you might already be knowing, but make sure that you don't make such mistakes on the day of the exam so that you don't actually lose marks unnecessarily. Now, another common question that students have or the candidates have in their minds is that, do you get time to check the answers? Yes, of course you get time to check the answers. At the end of each part of listening, at the end of part A, B and C, you get 2 minutes to check your answers. Especially when it comes to part A, if you feel that you're not very confident with the spelling of a particular word as you were writing it down while listening to the audio, then you can correct it during this 2 minutes of checking time. If you have excess time, then you can actually use this time to read the question of the next part. So that is one doubt that students have. Do you get time to check the answers? Yes, you have. Then another concern that students have is that, should you be writing exactly what you hear in the audio? Yes, it is very important that you write the exact words from the audio onto your answer sheet. You're not allowed to paraphrase, or you're not allowed to use synonyms while writing down the answers. The meaning might be the same, but you're not allowed to do so. You should be writing the exact word as you hear from the audio. Then singular and plural. Sometimes students, they might hear in the audio a singular word, but while writing the answer onto the answer sheet, they write it in plural form. Then also it is considered as wrong. If what you hear from the audio is singular, the answer should be written in singular form itself. If you have heard it in the plural form, it should be written in the plural form itself. Another question that students have in their minds is that, are articles important? But articles are not really important. For instance, if you write a, the, even if you write or even if you miss out these articles, it's not going to bring about a change in your score. So articles, it is not that important. Then coming to spellings. Are spellings important when it comes to listening? In part A, of course they are very important. If you make spelling mistake, that is, if you misspell a word, then you will not, despite your answer is right, you will not be getting a score for that answer if your spelling is not right. Then finally, how many right answers do you need to get in order to get a B score for your listening? You need to get at least 30. In total, you have 42 questions, and out of 42, at least you have to get 30 right answers to get a B grade. That is 350 out of 500. Okay, so that is how listening works. Now moving on to the reading section. We need to understand the format of the reading section as well. Now when it comes to reading module, here you have 3 parts, just like listening. You have 3 parts here, part A, B and C. In part A, what you have is, you'll have 4 different texts based on a single healthcare topic. Now what you have to do is, you have to, the challenging part of part A is that you have to complete part A in 15 minutes. Now what kind of questions you get in part A, I'll show you. In part A, the first 7 questions, question number 1 to 7 would be matching questions. So what you have to do here is, you have to quickly run your eyes through the 4 different texts, and based on that understanding, you have to match a specific information given in a question to one of these texts. Suppose for instance, the first question, procedures for delivering pain relief. If you find that information in text B, you have to write B here. Now here again, just like multiple choice questions, for instance, for question number 2, if I find the answer is A, but I'm confused between A and D, and if I write A/D, then you'll not be getting score for this particular question. So this is how you have to do the matching question. Then another thing you can do here is that you can ensure your consistency, that if you have written in, it's always good to write it in block capital letters. Now here you write B, okay, you get a mark here. And now here for question number 4, if the answer is D, don't write D, go for capital D itself. Okay, it's always good to maintain consistency. And again, keep this in mind, don't mark 2 options for a question. Now another question type that appears in part A of reading, apart from the matching question, is you have short answer questions and completion question. In short answer question, as the instruction says, answer each of the questions with a word or a short phrase. It can either be a single word, or a short phrase means maybe in 2 or 3 words. So that this is a short answer type of question which ends with this question mark. They are asking a question and you have to provide your answer in a single word or as a short phrase. Then another question type again which appears in part A of reading is completion type of questions, wherein you have gaps or blank spaces in between the sentences and you have to fill in those blank spaces with appropriate words from the text. Here again you have to be careful, just like how you did in listening. You should not do any paraphrasing. You have to copy the words as such from the passage and write it down exactly without making any alterations. In part B and C of OET reading, both contain, just like listening, in part B and C you have multiple choice questions. But the difference here is that in part B, each question will have 3 options, but when it comes to part C, each question will have 4 options. In OET listening, how we had in both part B and C, all the multiple choice questions had 3 options. But when it comes to reading, in part B you have 3 options and part C you have 4 options. Now in part B, what you get to read, it'll be short workplace text, mostly memos, notices or emails, approximately in 125 word range, and based on each workplace extract or text, you'll be having a multiple choice question. You'll have in total in part B, you'll have 6 such extracts. Now in part C, in total you'll have to answer 16 multiple choice questions. Now the 16 multiple choice questions is based on 2 extracts, 2 long around 800 word medical texts. So you'll have 2 long extracts, and based on these 2 extracts, in total you'll have to answer 16 multiple choice questions. Again, while answering multiple choice questions, just like how I've mentioned for listening, you have to be careful while darkening the bubbles. Make sure that you don't over darken or under darken it. Please do darken the bubbles carefully. Now regarding the time management is one concern that students mostly raise regarding when it comes to OET reading. So one thing that you have to keep in mind even during your regular practice is that for part A, you just have 15 minutes. So while practicing also, you have to keep that in mind. Don't give yourself extra time. That is, like maybe you would have completed your entire test in around 50 minutes or 55 minutes. You have 5 minutes remaining. So you might think that why don't I come back to part A and finish off my questions which I'm not sure there. But that should not be done, because you have to understand that for OET reading part A, your booklet for part A will be collected back by the invigilator or the examiner at the end of 15 minutes. So you'll not have a chance to go back to part A after that 15 minutes. Now regarding part B and C, B plus C together, you have 45 minutes. So some candidates starts with part C and then come back to part B, and some starts with part B and go to part C. It's like how you have practiced. It varies from candidate to candidate, how they find it convenient or how they find it effective in getting the answers. But whatever strategy you're following, make sure that you don't spend too much time on one single question. Now suppose if you're starting with part B, make sure that you spend in around approximately 10 to 12 minutes only for part B. Part B and C together you have 45 minutes, but make sure that you don't spend more than 12 minutes for part B. If you've crossed that, make sure that you should be in part C by then. Okay, so because you never know that, like if you spend too much time on one question, there might be simpler questions towards the end and you might fail to answer them rightly. So make sure this, you have to keep it in your mind. Don't get stuck onto one question. Now another question regarding reading is that should you write exactly as it is in the text, just like listening? Yes, here also it is very important that you copy the words exactly from the passage and write it onto the answer sheet. You should not be doing any paraphrasing or no synonyms are accepted. And when it comes to reading, you have all the words in the passage, so there is no scope for spelling mistakes. So be sure that you don't make any careless spelling mistakes, because you have the words there in the passage. You just have to copy it and write them down onto the answer sheet exactly. And when it comes to reading, how many right answers do you need to get a B? Just like listening, you have to get 30, at least 30 out of the 42 questions to get a B, or 350 out of 500. Now moving on to the next module, that is writing. In writing, what you have to do is you have to write a letter, one letter. You will be doing one letter, a formal letter. A formal professional letter is what you have to do in your OET writing subtest. And it is profession specific. Profession specific means, like if you are a nurse, it will be a different question paper for the nurse, and for a doctor it will be a different question paper, for a pharmacist it will be different. So OET writing subtest is profession specific, but listening and reading modules are not profession specific. So being a nurse, taking up the role of a nurse, you will have to write a formal professional letter to another healthcare professional. Now in the question paper, what you will be having is, you'll be having a case note which contains the story of a patient, all the details regarding the patient, like the social background, the past medical history, the recent medical happenings, the discharge plan. All of this will be contained in the case note. And along with the case note, you'll also have a writing task which tells the candidate that using the information from the case note, to whom you have to write the letter and what is the reason for writing the letter. Now, regarding the time distribution, the total time for your writing test is 45 minutes. In that 45 minutes, the initial 5 minutes is called as the reading time. Now, during the reading time, what you have to be careful is that you'll not be allowed to touch your pen or pencil. The invigilator will strictly instruct not to touch your pen or pencil, and you have to follow that. So during the 5 minutes, you should only be reading through the case note and writing task and understand it. Then once the 5 minutes is over, then you have 40 minutes of writing time, during which you are free to use your pen and pencil and you can start your writing. But another thing, it's a simple tip, but like it is really worthy, that is, you should not be immediately rushing into your writing after the 5 minutes of reading time. Take out time to plan your letter before you actually do your writing. Now, by planning, what I mean is that go over the case note once again. Earlier, during the 5 minutes of reading time, you have read the case note, but you have not done any markings on the question paper. Now you take out your pen or pencil and do proper markings on the question paper and set the stage ready for your letter writing. So what are the things that you should be doing as a part of planning? The first thing is that you have to explicitly do the data selection. Take out the pencil and clearly mark the relevant, irrelevant and semi-relevant information. Once that is done, once you know what all details are to be included in the letter, what all details are to be omitted from the case note, then you have to decide the structure. Structuring means the paragraphs. How many paragraphs you can have and what is the order of those paragraphs that you need to decide. So you know what to include and how to include. Now it's simple. You just need to transform the selected case notes into grammatically right sentence structures. Okay. Then another thing that you have to keep in mind is regarding the word count. That is, the word count for your letter should be in the range 180 to 200 words. So 180 to 200 words means the examiner is not going to literally count whether it is in that range of 180 to 200, in and around 180 and 200. So if it is a few words short of 180, provided that you have included all the necessary information, that is fine. If you have written up to 170 words but you have all the necessary content, then it's fine. And even when it comes to the upper limit, 200, even if you have crossed 200 words, but not too many words, more than 200, even if it is 2.5 or 2.10, but your letter is well summarized, then that is also not a problem. So if maximum possible, try to restrict your word count in that 180 to 200 range. Then another thing that you should pay extra attention would be what I would say is the purpose paragraph and the recommendation paragraph. And that is actually the highlight of the letter, the way in which you open the letter and then the way in which you conclude your letter. Because opening, it is the first impression about the letter that goes out to the examiner. So make sure that you craft it properly, and same goes with the recommendation. That is how you are winding up things, and it is going to have a lasting impression in the mind of the examiner or the evaluator. So make sure that you write the recommendation paragraph also in a precise, accurate way. Now, to score a B grade when it comes to OET writing, what you have to do, it is purely based on the assessment criteria. We have 6 assessment criteria, and for each assessment criteria, like for purpose criterion, if you score 1 out of 3, and for the rest of the criteria, if you score at least 5 out of 7, then you can get 27 out of 38, which means that you can get a B grade. At least if you get 27 by summing up the scores of all the 6 assessment criteria, then a B grade is guaranteed. Now we can move on to our final module, which is the OET speaking module. In speaking module, the format is, we start off with a warm-up session which lasts for about 3 to 4 minutes. So when I talk about the warm-up session, it is not something which is going to be evaluated. It's just to make the candidate comfortable with the environment, and the invigilator, so the interlocutor and the candidate would be just getting to know each other's voices. That's it. This part will not be evaluated. Once the warm-up session is done, then we'll move on to the role play. You will have 2 role plays to be done. Just like OET writing, OET speaking is also profession specific, which means that if you're a nurse, you would be doing the role play, taking up the role of a nurse, and the interlocutor will be taking up the role of the patient. And for each role play, you have 3 minutes of preparation time, during which you can make notes on the role play card which is given to you. And once the 3 minutes of preparation time is over, you have 5 minutes to actually perform the role play. Now, some questions regarding speaking that candidates have. Can we write on the role play card? That I already mentioned now. Yes, of course, you are permitted to make notes on the role play card. Like if you, for a specific task, how should you be starting the question? So like then as you start doing the role play, once you have completed the task, you can put a tick mark. All those are allowed. So which means that yes, you can make marks or notes on the role play card. Then, can you hold the role play card throughout the role play? Yes, you can do that. Until the end of that 5 minutes, you can retain the role play card with you, and you can refer back to the role play card as and when necessary. But just make sure that it should not be just like looking into the role play card and reading out the task. You can refer, you can have a glance on and off, and then speak in a very natural way. Then, can you ask questions to the interlocutor? This is another question which students often ask. If I have any doubts, can I ask it to the interlocutor? Of course, yes. You can do it during the 3 minutes of preparation time. If you are not very sure about the meaning of a specific word, what a specific word means, you can actually check that out with the interlocutor. Then, will you be penalized for not completing the role play card? See, it's not necessary that you have to cover all the tasks in the role play card in that 5 minutes. It's for assessing your speaking skill. Even if you have a couple of tasks left out at the end of 5 minutes, that's not going to be a problem. And even if you finish a bit early, that is also fine. But just you can be sure that just try and see that by summarizing what you have just discussed, you can just try to fill in those 5 minutes. Now, regarding the scoring for OET speaking, how to get a B grade, totally it is scored. Again, this is based on assessment criteria. Summing up the scores for all the assessment criteria, the total is 39, and out of 39, if you get 28, that is considering the linguistic criteria plus the clinical communication criteria. If you manage to get a 28 out of 39, then you can get a B grade. Now that we have seen the format and the do's and don'ts in the 4 different modules, I would also just like to quickly brief you on the basic or the general tips that might come in handy. That is a good night's sleep, eating good breakfast. That is, good sleep and good food are also equally important. See, as you know, OET, it's not a medical test, it's a skill-based test. So how fresh your body and mind stays, it's equally important. So make sure that you get ample amount of sleep, at least 7 to 8 hours of sleep, and have good breakfast on the day of the exam. Then another important thing is that you should be carrying all your necessary documents. Primarily your ID with which you have booked the exam. Please make sure that whether it be your passport or whatever it is, or it can be your Aadhaar card. So whatever it is, like with what ID you have booked the exam, make sure that you carry the same ID on the day of the exam. Then plan your travel, as in make sure that you reach the exam center well before time, at least 30 minutes before your exam, so that you can avoid last minute confusions. You have time to settle and just relax. Then stay calm and confident, take deep breaths, relax yourself. Then avoid last minute cramming. Maybe a friend of yours might be talking about a different strategy, different from what you have already practiced. Just ignore all those things. You have done sufficient practice. Just stick on to the strategy, what you have practiced, and give the best. Then follow the instructions carefully. Whatever instruction is being given out by the invigilator from the exam hall, you have to strictly follow that. If they ask to stop writing, make sure that you drop down your pencil or pen at that moment. Then stay hydrated, sip in water frequently so that your body and mind remains fresh. And last but not the least, never give up. Maybe like say the first module is your listening test, you might not have performed well in your listening test, but that shouldn't affect the performance in the rest of the modules. Once listening is done, leave it there and move confidently to the next module, that is your reading module. So till the end, don't give up, just fight. So these are some of the module-wise tips and general tips that you should be bearing in your mind on the day of the exam or during the preparation for your exam. Hope you found it helpful, and we'll be right back with more such videos. Stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.